Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Welcome, everyone. My name is Lauren. I'm the Program Director with Cancer Support Community Atlanta. Today, we're going to have a fantastic presentation done by Savannah Duffy. Savannah Duffy is a dietitian with Northside, and she works in the High Risk and Survivorship Department. Today, our program is on hormones, nutrition, and cancer. Thank you, Savannah, for joining us, and everyone online today. We're happy to have you. And Savannah, I'm turning the floor over to you.
Perfect. Thank you, Lauren. It's so great to have such a great turnout today and see some familiar and new faces on here. So I'm excited to talk about hormones, nutrition, and the link with cancer today. So before we get started, I do want to give a disclaimer. I'm a dietitian by trade. I'm not an endocrinologist who is probably going to be your provider who's really the leading expert on hormones. So I'm really going to keep this geared towards nutrition, the link to cancer, and there might be some questions that at the end I might have you ask your endocrinologist or oncologist because I don't want to make sure I'm giving you the right information. Okay, but what are we going to talk about today? We're going to do a brief overview over what the term hormone means and discuss the relationship between specific hormones on nutrition or hormones with nutrition on cancer risk. We're going to cover some common hormone and nutrition related questions that I get asked often and identify some strategies to reduce cancer risk throughout the presentation or to help maintain, our healthiest selves while we're going through cancer treatment. Okay, so let's get started. What are hormones? So hormones are chemical messengers that travel through your bloodstream and throughout your body, basically to communicate and send messages between or to different tissues, organs, and muscles in your body. They're very essential for your body to function. They tell your body to do certain things at certain times. For example, hormones are key regulators in the process of metabolism, which is a process that converts food into energy. It's also involved in homeostasis, which means trying to keep your body at a balance. It does this through regulating blood glucose, blood pressure, fluid retention, electrolytes, and so much more. Hormones are related to our growth and development, even bone health as we age. Sexual function and reproduction are linked to our hormones, as is the sleep cycle, so our circadian rhythms, partially driven by hormones, and even our mood. So far, we've identified over 50 hormones, but there are likely many more that have been undiscovered or are not quite understood yet. So that's important to know, is that learning about hormones is an ever-evolving science. We learn more and more every day, so we don't know everything there is to know about this part of our body quite yet. A lot of times when we talk about hormones or when you hear it in the media or online, especially right now on social media, hormones is kind of treated like a dirty word, like it's bad to have hormones. But as you can see from above, hormones are very necessary to our body's function. And so we're going to learn a little bit more about how our body works with hormones and what we can do to optimize our hormone health. Okay, so just like we have a respiratory system, a cardiovascular system, we have a system in our body for hormones, and we call that the endocrine system. So that's going to be, all the glands as well as the hormones produced by the glands. Things like your thyroid gland, your pancreas produces hormones, your sex organs, your ovaries, your testes, the pituitary gland, all of those are parts of the endocrine system. However, we also have other parts of our body that produce hormones. We're going to talk quite a bit about some hormones that are produced by fat tissue in just a moment, but your kidneys, liver, gut, and even placenta are also all developing hormones. So let's kind of shift and talk about some of those hormones that are in the body. The first hormone we're going to discuss is insulin. This is one you've probably all heard of, but maybe didn't realize was a hormone. So it's actually produced by the endocrine cells of the pancreas. And what it does, its main function is to help transport glucose or sugar from the blood into the cells to be used for energy. So when you eat a meal, maybe you had a sandwich for lunch, your body converts that into glucose that enters the bloodstream. And the insulin is a carrier that brings it to the cells to be actually used to fuel your body and the rest of your day. It also helps in breaking down fats and protein for energy as well. So, the higher the blood glucose that we have, the more insulin your body is going to produce. So, if you have a really high carbohydrate meal, your body is going to require more insulin to move all that sugar into cells versus if you have maybe a lower carbohydrate meal. And this is a perfectly normal process. Um, and so, just to clarify, we're not saying that to get rid of carbohydrates, but it is going to just trigger more insulin to be produced. So, what can happen is sometimes our insulin gets out of balance or might not be properly used by the body. So, we call this insulin resistance. So, what happens with insulin resistance is your body, maybe your muscles, your fat, or your liver, isn't responding appropriately to the insulin, or the insulin's not effectively taking glucose from the blood and carrying it into the cells. And as a result, your pancreas ends up producing more insulin to try to combat this kind of deficit. So, your body's pumping out more insulin. Over time, this can lead to hyperinsulinemia. This hyperinsulinemia at a chronic level can lead to prediabetes or diabetes. So, we do know that too much insulin, so hyperinsulinemia, which could eventually lead to prediabetes or diabetes, can activate certain signaling pathways in the body that can actually promote the growth of cancer cells or inhibit your body's ability to destroy the cancerous cells. So that's kind of where the link with cancer and insulin comes into play. Too much, we want the right amount. It's kind of like Goldilocks, right? There's too little, there's too much, and then there's just the right amount. At just the right amount, insulin is very helpful. But when we get into that too much category, it can affect our cancer risk and our body's ability to fight off cancer. Now, what's interesting is that when we have excess body fat, that is also linked with increased insulin resistance, meaning the higher our body fat, the harder it is for our body to regulate its insulin, and we might fall into this hyperinsulinemia category. So, what can we do to help support our insulin to prevent insulin resistance or manage it? So, a couple strategies here. The first one is to try to eat on a regular schedule and not skip meals. So, our body prefers a routine. And when we eat on a regular schedule, it kind of helps our endocrine system know when to release certain hormones to help digest food and maintain that healthy metabolism. Other things we can do include choosing higher fiber carbohydrates. So things like whole grains as opposed to refined grains are going to have more fiber. And that's actually going to take longer for your body to break it down into glucose, giving the insulin more time to do its job. Similarly, anytime you have a carbohydrate, it's best to pair it with a protein, a source of healthy fat, or other high fiber foods like your vegetables. in order to help slow how quickly the food is being turned into glucose. Of course, limiting added sugar intake, so not natural sugars like those found in fruit, but added sugars found in processed foods, as well as sugar sweetened beverages, can prevent a really high blood glucose spike. And we also have evidence through the research that some lifestyle strategies outside of diet can help support our insulin resistance. Getting adequate sleep every night, managing stress, and exercising regularly are all helpful in managing insulin resistance. So, to give you an idea of maybe a goal to start out with exercise, we do recommend, about 30 minutes of moderate physical activity a day, most days of the week. So, at least 150 minutes of moderate physical activity a week as a great starting point. Okay, so we're going to move on to talk about some other hormones now. And the next about four hormones we're going to discuss are linked to fat tissue. So, this first one that we're going to talk about is called insulin like growth factor, or IGF-1. Now, IGF-1 is helpful in managing growth hormone in the body. So it's kind of like a partner for growth hormone. It helps with developing or growing bones, tissues, I believe even repair of tissues after a wound, maybe surgery in some instances. Now, it is linked with cancer. So again, a little bit of the Goldilocks effect, too much or too little can have negative consequences. But what it does is it can inhibit cell death. So, again, what that means is it makes it harder for the body to destroy those damaged cells that could potentially lead to cancer. Or too much IGF-1 can actually still stimulate growth of cancer cells. So, cell proliferation, I always mess that word up, is linked to IGF-1. It's specifically in research been shown to be associated with primary cancers, including breast, colorectal, and prostate cancers, which are the three top cancers in the country. So, again, it's produced by fat tissue. So, if we have excess body fat, there's a high likelihood that we're going to start developing more IGF-1. Now, the next hormone is called adiponectin. It is also produced by fat tissue. But unlike IGF-1, this one actually has a role in reducing cancer risk. So it helps promote cancer cell death. It also has anti-inflammatory properties and is involved in different metabolic processes in the body, like enhancing the insulin sensitivity we just touched on a couple slides ago. While it is produced by fat tissue, we actually see that too much fat tissue, so, if we get into overweight and obese territory, can actually decrease the amount of adiponectin present in the body. Insulin sensitivity and cardiovascular disease are also linked with lower adiponectin levels. So I'm just kind of giving an overview of these hormones right now, but we're going to touch on some weight management strategies in just a second. Okay, so the next hormone that's produced by fat tissue is called ghrelin, or the hunger hormone. I like to remember this because ghrelin sounds like a little gremlin, and when I'm hungry, I'm like a little gremlin. So that's how you can help remember it. What it does is ghrelin helps your body store fat, triggers the release of growth hormones, and is involved in bone formation. We usually get rises and peaks in ghrelin every maybe 4 to 6 hours or so. So you'll notice that when we talked about eating on a schedule, this is linked with ghrelin as well, because if we can plan our meals every 4 to 6 hours, we're really listening to that hunger hormone, being a little bit more in tune with our body and eating when our body is asking for food. Now, what's interesting is that having more body fat is actually linked with decreased ghrelin levels. So you would think that you would be less hungry. However, we're not really sure what the link is with ghrelin and obesity at this point. What the current working theory is, or the hypotheses, is that obesity can cause or is caused by ghrelin sensitivity, meaning that folks are hungrier with lower ghrelin levels. So we're still trying to work that out and figure out exactly why that is or how that works. But just know, again, body fat can kind of mess with those ghrelin levels. Now, on the flip side, we've got leptin, and leptin is our fullness hormone. So, leptin aids in our metabolism and it also signals to our body when we're full. So, it helps reduce appetite. So typically, let's say it's approaching lunchtime, or maybe you skipped lunch to be on this call today. And so you're feeling that ghrelin, you're getting a little hungry. You start eating your meal. Your leptin is going to signal to your brain that you're starting to get full about 20 minutes after you start eating. So eating slowly can help you to kind of listen to that leptin levels versus eating a big meal really, really quickly. In about 20 minutes, you're going to have a stomach ache. So, again, being overweight or obese can lead to leptin resistance, causing elevated leptin levels. And what this does is too much leptin is linked with cancer by signaling excess estrogen production, promoting new blood cell development, and inhibiting or making it harder for your body to kill off cancer cells. So there are some links with too much leptin and cancer. Interestingly enough, getting omega-3 fatty acids in the diet, ideally through food first, and antioxidant intake can help the body respond to leptin. So your omega-3s are usually going to be found in things like your fatty fish. Antioxidants are found in plant foods. So your fruits, vegetables, whole grains, legumes are all going to be sources of antioxidants. Okay, so we just discussed how four different hormones are produced or affected by fat tissue and are potentially linked to cancer risk. So, of course, the question is, well, how can we manage our body fat to help keep our body strong and prevent it from developing a cancer or a cancer recurrence? So, number one is practice mindful eating. We've touched on this a little bit. Mindful eating is really listening to your body, being in tune with those hunger and fullness levels. Strategies that can help do this are eating distraction free, ideally at a kitchen table, eating slowly. So, again, over a 20-minute period of time to give your leptin and your body time to catch up to your meal, and eating when you're hungry and stopping when you're satisfied. Now, I will put a big asterisk on this because anyone currently going through cancer treatment might know that because of the cancer itself or the treatment, sometimes these hunger fullness hormones get out of whack and aren't very reliable. And in those instances, you may need to get on an eating schedule more often, or you might need to eat when you're not hungry in order to make sure you're nourishing your body. So these kind of bullet points we just went over are more for general, health, maybe post-treatment or pre-treatment when your body is really firing on all cylinders. Other strategies are incorporating a lot of fiber as well as protein in the diet to keep you full and satisfied longer. Now, with protein, you can absolutely do vegetarian or vegan sources of protein, things like your legumes, beans, lentils, seeds, etc. Or you can choose, your lean meats, which are going to be lower in fat but high in protein. So chicken, turkey, and fish. We also recommend being careful of your beverages. Those can be a sneaky source of calories without much nutritional benefit. Water is usually going to be your best bet. And of course, we do recommend limiting alcohol. Alcohol can add in quite a few extra calories, which can make managing your weight harder, in addition to the fact that there also is some link with alcohol and hormone disruption, which we'll touch on in just a few minutes. Lastly, we recommend limiting heavily foods. So, choosing foods that are whole from the earth the most often and limiting those things that have a really long ingredient list with items you might not be able to pronounce in order to make sure we're giving your body as many nutrients as possible. This picture here on the right is a sample picture of the plate method, which is a great framework for building meals that are weight conscious. So, in a perfect world, half the plate would be non-starchy vegetables, a quarter of the plate would be a protein, and a quarter would be a high fiber starch. And then you might have, a little bit of fruit to help boost up those antioxidant intake, as well as a low calorie beverage with your meal. So I really like this visual when I'm meal prepping and kind of deciding what I'm gonna make for the week. I think about this plate method and how I can get as close to it as possible, even if it's not perfect all the time. Okay, so now I'm gonna talk about cortisol. Cortisol is known as the stress hormone. That's kind of its nickname. Cortisol is actually produced by the adrenal glands, so part of the endocrine system, and it has several functions. It helps you respond to stress or danger. So, like your body's fight or flight response is driven by cortisol. It also helps increase your body's metabolism of glucose, controls blood pressure, helps your body reduce inflammation, and helps your body wake up in the morning. So again, too much cortisol can be a bad thing. It can cause, it can make it more difficult to lose weight or cause weight gain. It can actually disrupt your menstrual cycle. It can cause fragile skin or like thinning of the skin. And then not enough cortisol can do this the opposite. It can cause tiredness, muscle weakness, and unintentional weight loss. So you really want to help balance out your cortisol and kind of get it in that comfortable level. So how can we support our cortisol? Again, eating on that regular schedule, letting your body know when it's going to get fuel. That way, when your body's properly fueled, it doesn't have to rely on spiking the cortisol to keep you moving and grooving throughout the day. We recommend practicing good sleep hygiene. So, trying to go to bed and wake up at the same time every night. If you're having trouble falling asleep
Nutrition.
or staying asleep, we recommend limiting blue light before bed, trying to get sunlight earlier in the day if possible, sleeping in a cool environment. Strategies like that can help enhance your quality of sleep. Managing stress when we're chronically stressed, that can raise our cortisol levels. So whatever that looks like for you, whether it's, a social activity or prayer or meditation or just getting those 8 hours of sleep, taking a warm bath, whatever helps you to wind down is beneficial for supporting that cortisol. Exercising can also help with the stress hormone. So, getting that 150 plus minutes of physical activity each week, but also making sure you're taking 1 to 2 days of rest so your body can catch up and isn't kind of always in this overdrive mode. So, exercising too much can also raise your cortisol. So, you want to find that balance. And lastly, maintaining healthy relationships, finding your support system, especially if you are in the midst of your cancer journey, will tremendously help stress during this period of time. Okay. So now I'm going to pivot. I made a specific section to talk about estrogen and cancer because a lot of times when we think about hormones, estrogen is the one that comes to mind. So we're going to go over this for a minute. So, estrogen is a steroid hormone that's associated with the female reproductive organs. Now, estrogen is going to actually fluctuate. The amount of estrogen we have in our body is going to fluctuate throughout the course of our lifespan. So, for example, it's going to be lower during pregnancy and breastfeeding and menopause, as opposed to a premenopausal, not pregnant, not breastfeeding woman, or, a prepubescent person as well. Estrogen is found in men as well, but today we're just going to mostly be talking about it in the context of females. Overexposure to estrogen can increase the lifetime risk of hormone-driven cancer, so breast and ovarian cancer. So, what can we do for this? Well, number one, we have found that breastfeeding is actually beneficial for both mother and baby. We have evidence that breastfeeding helps protect the mother against breast cancer, as during that period, like I said, it does lower the amount of estrogen that your body is producing. So, the longer you're breastfeeding for, the lower your total estrogen exposure over the course of your life will be. What's also interesting is at the end of breastfeeding, the body is going to get rid of any cells in the breast that may have DNA damage. It's kind of like almost like a little cleanse after breastfeeding. Studies have shown that for every 12 months or a year of breastfeeding, risk of breast cancer decreases by 4.3%. Now, interesting enough, breastfeeding has also been shown to reduce cancer risk in babies. And the reason why, or the hypothesis of why, is because breastfed babies tend to have healthier body weights later in life. And we know that when we have a healthier body weight, when we don't have that excess body fat, we are at a lower risk of developing a cancer. So all that to say, if this is something that you're considering and it's possible, then breastfeeding will likely have a benefit in terms of reducing cancer risk. Estrogen has also been linked to alcohol. So we do know that drinking even small amounts of alcohol is linked with an increased risk of breast cancer. To be clear, it's also linked with increased risk of 12 other types of cancer. Pancreatic, colorectal, prostate cancer, and more are also linked. But specifically right now, we're going to talk about alcohol and estrogen. What it does is it actually changes the way a woman's body metabolizes estrogen, which can lead to a rise in estrogen level over time. So, to make sure that we're supporting our body and reducing the risk of developing or a recurrence of breast cancer, best practice is going to be to avoid alcohol altogether. However, if you're choosing to drink, the American Institute of Cancer Research is recommending that women limit their alcohol to 1 drink a day, and then men limit it to 2. Okay, so we also get a lot of questions about soy foods and estrogen. So I want to clarify this today if you haven't heard my spiel in some of the other presentations so far. So soybeans are legumes, they're native to Eastern Asia, and they're an excellent source of protein. So a lot of times, you'll see vegan or vegetarian meat alternatives made out of soy, or we'll choose whole soy foods like tofu, tempeh, edamame as a protein source at meals. So the confusion about soy stems from the term phytoestrogen. So phytoestrogen literally means mini estrogen. So what happened was back in the 1980s when the scientists were first looking at soy in depth, they found these chemicals that looked like estrogen at a smaller extent and they named them phytoestrogens. So basically, what they hypothesized is if you ate these phytoestrogens, it would increase the total amount of estrogen in your body. Well, since then, they have found that that's not true, that these phytoestrogens are not estrogen and they don't raise estrogen levels in females. And in fact, they do have isoflavones or certain types of phytonutrients that are linked with fighting inflammation in the body. So we do actually hypothesize that getting whole soy foods, is a great source of these phytonutrients that can help reduce cancer risk. But right now, we're saying whole soy foods are completely safe and will not raise the estrogen in your body. The caveat here is that we're talking about whole soy foods. We don't have conclusive research on soy derivatives, typically called soy protein isolate or some form of soy protein, which again, you'll find that on an ingredient list of maybe something like a vegetarian or vegan meat alternative, or many protein bars are made from a soy derivative. What we recommend is trying to avoid that if possible. It's probably not the end of the world if you are exposed to it every now and again, but try not to make these soy derivatives a part of your daily diet, just until we have more conclusive research. Okay, so we've got a few more slides to go over before questions. So I'm going to address some common questions I get about hormones and our food system. The first question, a lot of times people get confused because our dairy products in the grocery store are often labeled as no hormones added. So, what does this mean? All milk is going to contain a hormone called bovine somatotropin, or BST. This is a hormone that's naturally produced by cows. Okay. Now, our BST is the synthetic form, which is often used to help increase milk production in cows who maybe aren't producing enough of it. Now, again, so this is a naturally occurring hormone found in cows. Protein hormones like bovine somatotropin are broken down in the stomach and aren't absorbed by the body intact. Therefore, the consensus is that they are not affecting human hormone levels. Okay. Now, in fact, when we look at research on dairy products and cancer, we do have some different findings. So, we do see that dairy consumption is likely linked to decreased breast cancer risk. This is possibly due to the vitamin D and calcium intake, but at this time we don't have a conclusive evidence. On the other hand, when it comes to prostate cancer, we're finding that dietary calcium from dairy was linked to increased prostate cancer risk. Now, this does not mean that dairy causes prostate cancer. What we find is when folks are getting really high amounts of dairy and therefore high amounts of calcium, greater than 1,500 milligrams a day, it has been shown to increase prostate cancer risk in men. So, the research is looking a little different on breast versus prostate cancer, but kind of to recap that and apply that to us, what we're going to say is that moderate intake of dairy, which is about 3 servings a day, is not only likely beneficial, but it's going to be recommended. Now, beyond that, if we start getting more than 3, 4, 5 servings of dairy a day, it's going to be a lot harder to just have a balanced diet and make sure we're getting all the food groups, in addition to specifically for men, potentially increasing prostate cancer risk. So again, everything kind of in balance or in moderation. Now, if you are concerned about the RBST that's going to be found in dairy products, there are these options on the market that are labeled hormone free. And if that gives you peace of mind, I would absolutely encourage you to choose that option if that makes sense for you and your family. Okay, so now I'm going to talk about meat and cancer. So this can be a little bit confusing sometimes. So, we've talked about hormones and how they're naturally occurring, right? So, natural hormones like estrogen, progesterone, and testosterone, as well as some synthetic hormones, are used in meat production. However, the FDA is regulating how much of these hormones are allowed in foods, dependent on levels that are deemed harmful to human health. So they have a pretty significant gap between the threshold of what's allowed in food production versus what research shows us is harmful. So the amount that's allowed to be used is much, much lower than what they deem is a harmful level. It's important to know that the amount of hormones that's potentially added to meat products is significantly less compared to the naturally occurring hormones that are already found in those animals, as well as significantly less than the amount of hormones that are already found in our bodies. The current consensus is that these hormones are not increasing hormone levels in humans. So we're not seeing, when we look at scientific research, that consuming meats is increasing hormone levels in humans. However, I always like to encourage everyone to remember to eat meat as part of a plant-forward, balanced diet to make sure you're taking advantage of all the great phytonutrients, fiber, protein that's found in plant foods. Okay, so in conclusion of everything we've talked about today, I know it's been a lot, but hormones are a necessary part of our body. We can't exist without them. What we can do is help support our hormone health through lifestyle factors like managing our body weight, our stress, and staying physically active. Again, if you have, we'll go over some questions. If there's anything I can't answer today, feel free to reach out to your endocrinologist, your physicians, or the registered dietitian you're working with to continue setting some goals to either help your hormones or to clear up any confusion regarding maybe your hormone levels and what's best for you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.